Good morning, doctors. Welcome again. Today we are going to discuss about Psychiatry Part 4 NEET PG 2020 MCQs. Let's start. Most common of all psychiatric disorder are anxiety disorders. Okay, C option is right here. Now, not a anxiety disorder, phobia, PTSD is post traumatic stress disorder, conversion reaction or OCD. So answer is conversion reaction. Okay. Phobia is a type of mania, depression, neurosis, psychosis. So phobia is a type of neurosis. Neurosis means insight is present. Anxiety is a type of neurosis, psychosis, personality, and these none. So answer is neurosis. Okay. Now, sudden onset pain in chest, perspiration, and feeling of impending doom can be seen with asthenia, acute dystonia, panic attack, or migraine. So answer is panic attack. Okay, now all of the following can be considered as a treatment for anxiety except serotonin reuptake inhibitors, benzodiazepines, dopaminergic blockers, and buspirone. So answer is dopaminergic blockers. Okay, now a 25-year-old female presented with chest pain, palpitations, perspiration, when the deadline to submit the presentation was close. When investigated, she was medically normal. The condition is panic attack. So, B is the right one. Okay. Phobia is defined as excessive, unreasonable fear about a specific situation or palpitation on thinking about a definite entity or altered perception or perceptions without stimulation. So answer here is excessive unreasonable fear about a specific situation is known as phobia. Okay. Now commonest phobia is photophobia, agoraphobia, thanatophobia, acrophobia. So commonest is agoraphobia. Agoraphobia. Okay. Now, agoraphobia is described as fear of being in unfamiliar places, fear of closed spaces, fear of heights, fear of dogs. So, this is the fear of being in unfamiliar places is known as agoraphobia. Okay. Agoraphobia is best described by fear of crowded place, fear of closed spaces, fear of open spaces, fear of both crowded and open spaces. So answer here is D, fear of both crowded and open spaces, but closed space fear is known as claustrophobia. Okay. Thanatophobia is defined as a fear of closed space. Closed space is claustrophobia, high places, flights, or D is death. So death is a thanatophobia. Okay. Fear of death is known as thanatophobia. A student unable to deliver his speech before audience is suffering from agoraphobia, OCD obsession compulsion disorder, social phobia, or claustrophobia. Agoraphobia means fear of being in crowded place or in open spaces. Or claustrophobia means fear in a to be live in a closed space like lift, etc. In a closed room. Claustrophobia. Social phobia. This is because he can't able to deliver his speech in front of public. It's social phobia. Flooding is a type of behavior used in mania, depression, phobia, or schizophrenia. So answer is phobia. Okay, so this is an answer key. You can check your all answers from here. If you have any queries, any question, you can ask me. Recheck all list. Pause this video now. Irresistible urge to do a thing repeatedly is seen in schizophrenia disorder, obsessive compulsive disorder, or depression. So answer here is OCD. It's obsessive compulsive disorder. Okay. OCD is associated with depression, ecstasy, mania, insomnia. So OCD is associated with depression. Why? Because they have some obsessions, some thoughts generated repeatedly, and if they are not following their thoughts, act its compulsion, then they develop depression. Okay. Repeated action done after an irrational impulse is called compulsion. Okay. So C is right here. Now, which of the following statement differentiate obsessional ideas from delusion? Okay. The idea is not conventional belief. The idea is held on inadequate ground. The idea is regarded as ego aligned by a patient. The idea is held in spite of contrary evidence. So they are asking obsessional idea differentiate from delusion. So answer here is the idea is regarded as ego aligned by a patient. Okay. Commonest symptom in obsessive compulsive disorder is compulsive checking, compulsive thinking about the same, obsessive perception, compulsive washing of hands. So answer is compulsive washing of hand. Okay. Fear of contamination and having to check and recheck are the features characteristic of obsessive compulsive disorder, agoraphobia, panic attack, generalized anxiety disorder. Check and recheck features is obsessive and compulsive disorders. Okay. Genetic link of development of anxiety is characteristically seen in which other psychiatric illness, that is obsession compulsion disorder, depressive disorder, personality disorder, manic disorder. So answer here is obsessive compulsive disorder. Okay, which transmitter is mainly involved in obsessive compulsive disorder? That is dopamine, noradrenaline, norepinephrine, or we can say serotonin or GABA. So answer is serotonin. Okay. Now the drug of choice for obsessive compulsive disorder, that is chlorpromazine, fluoxetine, benzodiazepine, imipramine. So answer here is fluoxetine. Fluoxetine, that is okay. Psychosurgery is used in which of the following disease? Phobia, depression, OCD, generalized anxiety. So answer is OCDs. Okay. Now move on next page. Post traumatic stress syndrome is due to major life threatening events, CVD, minor stress, head injury. CVD is cerebrovascular accident, and so answer here is major life threatening events. Okay. Now a 45-year-old man complains of gradual decrease in size of his penis. He is afraid that it was disappear completely one day. The psychiatric disorder which present with this phenomena is Coro syndrome, Dart syndrome, Malingering, or hypochondriosis. So this term is known as Coro syndrome. So guys, this is answer key. You can recheck all MCQs which I explain you. If you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you. Good day. Goodbye. That's all for today. Have a nice day.